Very good morning, everyone. Today I am going to talk about cognizance of study designs. What do you mean by research? It's a set of methods and procedures used to collect and analyze data on variables specified in a particular research question. In your PG curriculum, all of you have to do a thesis. You may do a short studies and surveys for scientific presentations in conferences and PG conventions, and also the systematic review as your library dissertation. So you need to know about various study designs. Study design is more important than analyzing. Poorly designed study can never be recovered, but poorly analyzed study can be reanalyzed to reach a meaningful conclusion. Why research for master's degree? For you to do a holistic approach to understanding a clinical problem, and as a PG for you to have a research exposure, and by doing a good study, you can contribute to the evidence-based dentistry. Before starting your research, you have to analyze, will my research have clinical applicability, be innovative, be cost effective, and have a social impact. This is the pyramid of scientific evidence. All of you are aware of it. The animal and the laboratory studies occupy the lowest level of the pyramid with the lowest evidence, followed by case reports and case series. Then comes the observational studies like a case control studies and cohort studies, followed by randomized control trial, and the secondary pre-appraised filtered studies like meta-analysis, systematic review, and the clinical practice guidelines occupies the highest level of evidence. Now we will see about the study designs. What are all the types of studies? It is broadly classified into non-experimental, that is observational studies, experimental, interventional studies. The observational studies are subdivided into population-based and individual-based studies. The descriptive health survey, analytic ecological study, all comes under the population-based observational studies, and the individual-based is further subdivided into descriptive and analytic. In this case series and case report comes under a descriptive study, and cross-sectional case control and cohort studies all comes under the individual based studies. The interventional studies are divided into randomized and non-randomized studies. The randomized ones are clinical trials and the non-randomized ones are quasi-experimental, field trial and community trial. Now we will see about all these study designs one by one. Observational studies means documenting a naturally occurring relationship between the exposure and the outcome. Not have any active intervention in any individual, and the exposure has already been decided naturally or by some other factors. It includes a wide range of studies in which the course of events is studied as it unfolds. Since it is non-experimental and uncontrolled, we cannot draw casual research conclusions from it. The observational data collected is frequently qualitative observations, but it can also be quantitative and both. This study is a 10-year observational study published in Journal of Endodontics. It shows the additional treatment indicative of an unfavorable endodontic outcome in a Swedish county. What are all the pros and cons of this? It provides a practical application for a hypothesis. In other words, it can help make research more complete. The disadvantages are there is a chance of researcher bias in observational studies. In other words, there are numerous situations in which observation alone is inadequate. Now we will move on to descriptive studies. It describes the data on one or more characteristics of a group of individuals. It does not try to answer questions or establish relationships between variables. What are the data collection methods in descriptive studies are by means of a survey, by observation as a case study. What do you mean by case report? It provides a detailed and comprehensive description of the atypical type of a clinical presentation. It is one of the earliest forms of research and provides an opportunity for the investigator to describe the observations that make a case unique. Case series. It is a series of case reports which is an atypical presentation found in a group of patients. Many case reports and case series are anecdotal and of limited value. However, some of these bring to the fore a hitherto unrecognized disease and play an important role in advancing a medical science. This is a case report with a 9-year follow-up in which they have actually documented a successful root canal treatment of an atypical mandibular canine with a boomerang-shaped root canal system. The second one is a case series published in IJDR. It has 3 case reports by means of a guided endodontic surgery. What is cross-sectional survey? It's a type of observational research that analyzes data across a same population at a specific point in time. It is also known as cross-sectional study, transfer study, prevalence study. It measures the prevalence of a disease or a risk factor, thus assessing the disease burden and healthcare needs. What are the advantages? It is inexpensive and fast. It provides data on multiple variables and they often prompt additional research. The disadvantages are the inability to determine the cause and the effect. There are existence of cohort differences and a potential for survey bias. This is an example for a cross-sectional survey. In this, the impact of coronavirus disease on a clinical practice of endodontists across US is represented. Now we will move on to the advantages of descriptive studies. It is very easy to conduct, no serious ethical scrutiny except confidential information like sexual practices, substance abuse, etc. Studies done in different populations or done at different times in same population. It may help to identify geographic variations and temporal change in the frequency of disease. This may help generate hypotheses regarding the cause of the disease, which can then be verified using another more complex design. It estimates the burden of a disease in a population and is useful for resource planning. The disadvantages for a case report and case series, we are actually presenting a solitary patient or only a few cases who may represent a chance occurrence. Hence, conclusions based on these run the risk of being non-representative and hence unreliable. We will see now about the analytical research. In analytical observational studies, researchers try to establish an association between exposure and the outcome. These are all the types of the analytical studies. It depends on the direction of the inquiry. These studies can be directed forwards or depends on the timeline. It may be a prospective cohort study or a retrospective cohort study. First, we'll see about case control study. Both exposure and outcome have occurred before the start of the study. It's ideal for rare diseases. In case control studies, the researchers first enrolls cases and controls and then tries to elicit a history of exposure in each group. The study proceeds backward from the effect to the cause. These are all the basic steps in doing a case control study. The data is collected by means of interviews, questionnaires, past records of cases like hospital records and employment records. Now we have to be familiarized with certain terms used in these studies like matching. What do you mean by it? It is the process of selecting the controls so that they are similar to the cases in certain characteristics like age, race, sex, socioeconomic status, and occupation. What do you mean by odds ratio? The result of analysis, that is a measure of association in a case control study, is known as odds ratio. And relative risk, it's the ratio of probability of the event occurring in the exposed group to the probability of the outcome occurring in a non-exposed group. And there are a lot of bias. We have to minimize the bias in our research, like confounding factors, memory or recall bias, selection bias, Bergsonian bias, and interviewer's bias. What are all the advantages? It's easy to carry out, rapid and inexpensive, require comparatively few subjects, no risk to the subjects, and allow the study of several different etiological factors and no attrition problems. And the disadvantages are the problems of bias, relies on memory or past records, selection of an appropriate control group may be sometimes difficult. It cannot measure incidence. Another major concern is the representativeness of cases and controls. There are subtypes in this like nested case control study, case cohort study, and case crossover study. Now we'll see about cohort studies. Cohort is defined as a group of people with a shared characteristics. Cohort studies are study designs that compare two groups, such as the subjects with exposure to the subjects without exposure for difference in incidence of outcome or a disease. These participants have to be free of the outcome at the baseline. So these are all the steps in carrying out the cohort studies. It has greater validity in situations where experimental studies are not feasible. Cohort studies are a reasonable and arguably a better alternative. Now we'll see about prospective cohort study. The investigators design the questions and the data collection procedures carefully in order to obtain accurate information about exposures before disease develops in any of the subjects. After baseline information is collected, subjects are followed up longitudinally, that is over a period of time, to determine if and when they become diseased and whether their exposure status changes. For example, one could identify smokers and non-smokers at baseline and compare their subsequent incidence of developing heart disease. What is retrospective cohort studies? It is, in this, they look backwards in time to examine the relationship between the exposure and the outcome. It is crucial to note that in order to be considered a retrospective study, your participants must already possess the disease or health condition being studied. For example, if you are interested in how mosquito-borne diseases spread, you interview a cohort of people who have been hospitalized with severe dengue fever, asking about the events surrounding their illness and their medical history to study the spread of the disease. What are all the advantages of cohort studies? For exposure to be causative, it must precede the outcome. For a given exposure, more than one outcome can be studied. That is, several exposures can be studied simultaneously. The negatives are, it requires a long duration of follow-up to determine whether outcome will occur or not. It is not uncommon for one or more unknown confounding factors to affect the occurrence of outcome. This is the prospective cohort study published in Journal of Endodontics. In this, 125 patients with a cracked teeth with reversible pulpitis were recruited. Pre-op data, including patient and tooth factors, were collected. Cracked teeth were bonded and reviewed until symptoms resolved before referral for the coronal coverage. This one is the retrospective cohort study. In this, they analyzed the high survival rate of 632 teeth treated with apexification with an average follow-up of 64 months through analysis of dental insurance claims. Now we will move on to ecological studies. The ecological study design involves looking for association between an exposure and an outcome across populations rather than in individuals. It is also sometimes called as correlational studies. These studies are convenient to do since the data have often already been collected and are available from a reliable source. Let us move on to cross-sectional and longitudinal study. The analytical cross-sectional study, the investigator assesses the relationship between the presence of an exposure and that of an outcome in a single group of patients at a specific point in time. They are typically used to assess the prevalence and infer the cause of the condition or outcome. The general design involves defining the target population, deriving a sample of that population, and defining the characteristics being studied. Longitudinal study, in this the subjects are followed over a period of time with a continuous or repeated monitoring of risk factors or health outcomes or both. At one extreme, a large population may be studied over decades. Most longitudinal study examine associations between the exposure to known or suspected causes of disease and subsequent morbidity or mortality. This is an example for a cross-sectional study. In this, 54 patients who underwent endodontic microsurgery from Jan 2017 to November 2021 were enrolled. They were assigned to the concentrated growth factor and control group according to whether the CGF was used during the surgery and followed up at 6, 12 and 18 months after surgery. This is an example for longitudinal clinical study. In this, they assessed the outcome of non-surgical root canal retreatment procedures obturated with warm Gataparka technique. To summarize the observational studies, here I have tabulated the strengths and weaknesses of various studies. Now we move on to the second half of the presentation, that is the experimental research. The researchers actively interferes with nature by performing an intervention in some or all study participants. The experimental study designs, that is the interventional studies, by their very design are prospective. They are divided into clinical trial, field trial and community trial. Under clinical trial comes the randomized control trial, non-randomized one, crossover trial and factorial trial. Others are like parallel studies and a split mouth study. First, we'll see about randomized control trial. The randomized control trial involves randomizing subjects with similar characteristics to two groups or multiple groups, the group that receives the intervention and the other group that receives the placebo. The randomization is typically performed by using a computer software manually or by other means. Hence, we can measure the outcome and the efficacy of the intervention being studied without bias, as subjects have been randomized to their respective groups with similar baseline characteristics. This is considered as a gold standard in medical research since they offer the best answers about the effectiveness of different therapies or intervention. Some additional methodological features are often added to this study design to further improve the validity of a trial. These include allocation concealment, blinding, intention to treat analysis, measurement of compliance, minimizing the dropouts, and ensuring appropriate sample size. These are all the steps in carrying out the randomized control trial. These are all some of the examples for randomized control trials published in European Endodontic Journal. And we'll see about what is parallel trial. So comparison are made between two randomly assigned groups. One group exposed to specific treatment and the other group either not exposed or exposed to another treatment. What do you mean by crossover trial? Each participant. Now we will see about the crossover trial. Each participant first receives one intervention, usually by random allocation. At the end of this first intervention, each participant is switched over to other intervention. And there are factorial designs also. Then we will move on to the community trial. That is a cluster randomized trial. Sometimes an intervention cannot be easily administered to individuals but can be applied to groups. In such cases, a trial can be done by assigning clusters, some logical groups of participants to receive or not to receive the intervention. However, such studies need a somewhat larger sample size than individual randomized studies and the use of special statistical tools for data analysis. What do you mean by field trial? It's known as a preventive or a prophylactic trial, and the subjects without the disease are placed in different preventive intervention groups. One of the examples for the field trial would be to randomly assign two groups of a healthy population and to provide an intervention to a group such as a vitamin and following through to measure certain outcomes. What do you mean by split mouth study? It is used in some clinical trials, make a randomization scheme on a site level where two treatments are randomly assigned to sites of one of the two halves of the mouth. This is one such split mouth study in which the biodentin and MTA was used as a direct pulp capping agent in both the quadrants in molars for better standardization. Coming to non-randomized controlled clinical trials, in this design, participants are assigned to different intervention arms without following a random procedure. For instance, this may be based on the investigator's convenience or whether the participants can afford a particular drug or not. Although such a design cannot suggest a possible relationship between the intervention and the outcome, it is susceptible to bias, with patients in the two groups being potentially dissimilar and hence validity of the results obtained is low. What is systematic reviews? The traditional narrative review do not involve a systematic search of the literature, leading to a potential for subjectivity or a selection bias. In contrast, systematic review involve a formal pre-specified protocol with explicit transparent criteria for the inclusion and exclusion of the studies, thereby ensuring completeness of coverage of the available evidence and providing a more objective, replicable, and comprehensive overview. These are all the steps in doing systematic review. First of all, we have to state the review question. You should search the Cochrane library. In addition to results obtained from the Cochrane database of the systematic reviews, the control trials in Medline and MBase also has to be included. The certainty of the evidences was assessed using the grade system. That is the grading of recommendation, assessment, development, and evaluation approach. This is the preferred reporting items for systematic reviews and meta-analysis. The performance of meta-analysis is contingent upon a good quality systematic review. Meta-analysis following a systematic review. Data from individual studies may be pulled quantitatively and reanalyzed using established statistical methods. These are all the steps. First of all, we have to understand the heterogeneity. Then the tests for heterogeneity. If it is high, then it is not suitable for meta-analysis. And then finally, we have to form a forest plot. The typical graph for displaying the results of meta-analysis is called forest plot. The plot shows at a glance information from the individual studies that went into the meta-analysis and an estimate of the overall results. This article is an example for systematic review. In this, the comprehensive literature search was conducted using the electronic Embase, Web of Science and PubMed databases, followed by citation searching for articles eligible per the inclusion criteria. Total of 1,845 citations were screened, of which 13 articles met the inclusion criteria and were included in this review. All included articles were in vitro studies with low to moderate quality assessment scores. This is an example for systematic review with meta-analysis. In this, what they have done in this article is the search strategy involved researching 6 databases and the grey literature. Publications were accepted in any year or a language that identified archaea in samples from the root canals. This table shows how to choose an appropriate study design for your research question type. And some important assessment criteria for formulating a study. The classical approach is to identify research question, keeping in mind the PICO format, that is a population, intervention, control, and outcome. And then the finer criteria, that is feasibility, interesting, novel, ethical criteria, and then thorough literature search. If it is a well-defined research question, it will lead to an appropriate study design and methodology. Discussing your research question with knowledgeable peers, department chair, mentor, and the biostatistician from the start will lead to the completion of a successful projects. Other steps such as type, phase of the clinical trial, budget, informed consent, resource constraints, facilities, and a timeline should also be considered while formulating a research question. These are some of the tips for the literature review. Once a preliminary question has been formulated, literature search should be done. The goal of the literature review is to determine what research has been conducted on the topic of interest, and how has it been conducted, and what are the gaps in the knowledge. It is recommended to use PubMed, Medline, or Web of Science as the main search databases. The Equator Network is an international initiative that aims to improve the quality of research publications. It provides a comprehensive list of reporting guidelines and other materials to help improve reporting. To help the reporting your research, there are reporting guidelines that is given in this table. These contain a checklist of a minimum points that you should cover when you are writing your manuscript. This flowchart shows how to finalize your research question and select appropriate study design. To summarize, first of all, you have to attend some research methodology course or a workshop. Then main thing is formulation of the research question. Familiarize yourself with the existing research on the topic. You have to do a thorough literature search. Then research design selection is very important. Consider what impact your research could have and design your methodology appropriately to ensure your data answers your research questions. And good research design should minimize bias, maximizes reliability of the data, and yields maximum information. And then what do you intend to test? What is the relationship among the variables and all you have to analyze, and then we have to submit a protocol to the get a institutional review board or a ethical clearance to carry out the study. And then we have to do a study based on the study type. We have to do a CTRI or a Prospero etc. Then comes the pilot study. You have to do pilot study to find out the feasibility of the study. And then finally you have to collect your data, then interpret your results, work out the implications of the data you collect, and then proper scientific discussion, how do they relate to the previous findings. Everything has to be discussed in detail. And then this your study, whether it opens avenue for the further future studies, has to be mentioned. And finally, the main important one is you have to contribute to the good quality publication. So, to conclude, each study design is different. The quality of your research and the evidence it provides can greatly can be greatly affected by your choice of study design. Each study design has its strengths and limitations. Understanding the different types of study designs can help you design studies that are rigorous and can generate useful evidence, contributing to the overall knowledge. These are all some of my references. Thank you. Thank you for this wonderful opportunity. Thank the organizing committee of the SRM Dental College and Manav Rachna Dental College. My special mention to Dr. Mahalakshmi ma'am and Dr. Dax Abraham sir. Thank you one and all.